Hello, you are listening to the OmniTalk Fast 5, brought to you in partnership with the A&M Consumer and Retail Group, Firework, Trigo, Sezzle, and Silk.
All right, headline number 2, staying in the healthcare lane.
Oh, yes.
We always like to stay in our lanes, Ann, on this show.
Never.
Dollar General plans to open mobile healthcare clinics.
Mm-hmm.
According to Chain Store Age, Dollar General is partnering with DocGo Inc. I can't believe it, but it's true.
It reminds me of, I read that and I was like, Go Doc Go.
I know,
Like
right? Go DocGo, the children's book. That's awesome. But DocGo Inc., which, quote, is a provider of mobile health and transportation services, end quote. The clinics are essentially vans that will be set up in the parking lots of 3 Dollar General stores in DG's home state of Tennessee, and they will offer a wide range of preventative care services in addition to urgent care services and chronic condition management for conditions such as high blood pressure, diabetes, asthma, and chronic obstructive pulmonary disease. Very specific.
Yes.
On that last one. So
you know who you are out there,
Yeah,
chronic
right.
obstructive pulmonary disease.
Trying to hit an audience,
Sufferers,
I guess.
yeah.
Said Dollar General's chief medical officer, Albert Wu, and yes, Dollar General has a chief medical officer.
They got it now.
Yeah, right. Quote, these clinics demonstrate our ability and desire to work with our customers to bring affordable health and wellness closer to home while equally establishing Dollar General as a trusted partner where customers can access health services, end quote. Ann, your thoughts here, please.
Well, first
Starting off with health and wellness.
I have to say, like, this week's stories are very interesting to me because said in a different way with a different lens, like $5 drugs, all you can eat drugs, and then now we're doing vans that are providing healthcare in a parking lot. Like, this could be misconstrued very easily, but
Could be some side businesses going on
I know,
here very
like
shortly.
this could be questionable, but I think like the first thing I thought of was like this is how Rite Aid, which we were talking about earlier in the year, this is how they should be doing the mobile
I
pharmacies.
thought the exact same
yeah.
thing.
Like
First
that was
thing.
the first thing that came to mind. Like,
Yep.
yeah, it's mobile. Like,
Yep.
why would you force somebody to be stationed all day
Right.
in one spot when there's just not enough demand to
100%.
require them there? So I think that makes sense. You're
100%.
still getting closer to those rural communities. You're still closer than the closest urgent care in most cases. Like the Dollar General is, people have access to Dollar Generals much more than they do any of those clinics. The question that it raises for me though is like how are prescriptions handled for this, especially for like some of those urgent care like strep, for example.
Right.
Like I
because
just
this
had
isn't
strep
pharmacy.
last week.
That's the key difference
Right.
between this and Rite Aid.
So
right.
how do you is that going to be a component of this? Because that's still then another trip somebody has to go on. If I have strep or I have, some other thing that I need a medication for that day, like what am I going to do then? Where am I driving to? So is that opening up new avenues for Dollar General? Can these mobile vans be do they contain these sorts of things if they are the clinic? But I think, this option in combination with them expanding grocery now into the space, like you've got a one-stop shop that's, I think, really smartly being constructed in a very mobile, like as mobile as a physical store can be.
Yeah.
They are trying to add on all these things. So I love it.
That's a great point that you're bringing up because because opportunity is born, businesses are born in opportunity. And so it's actually a great problem to have if you're the chief medical officer, Albert Wu, to try to help Dollar General solve. Like, oh, you have these clinics. Now, where do patients need to get their medicine?
Right.
Oh, I'd like to try to solve that problem, honestly.
Right.
There's just dollars there for the taking. And, my point is exactly, I thought the exact same thing you did. Like, I poo-pooed the Rite Aid move last year. But this is different because of the mobile aspect. DG's not tied down to the real estate footprint, which is important because of the staffing, right? You're not having to staff docs permanently at a location.
Right.
The docs can pick up the truck and go wherever they're needed that day. And so it makes me wonder if the same approach can't be worked in pharmacy. I mean, remember Breaking Bad? Walter White and Jesse
This is what
did
I
the
mean.
same thing out of basically a
Conversion
Winnebago
van,
in the desert of outside Albuquerque. So the who knows if that's real, but the techniques are there to make this work. So God knows pharmacists are way more hard to come by, I think, from my experience, than medical staff.
Yeah.
So the mobile approach, I just think it makes sense for both things. And your point is great because that's probably going to be a demand that's there.
I would think. We'll see. Again, walking the very fine line of selling meth and also prescription drugs.
Anytime we could get a
Out
Breaking
of a
Bad
van.
reference in the show, I mean, that might be a first time too. I love that.